The world of medicine is changing rapidly. We are witnessing a digital transformation in healthcare. This revolution is driven by powerful new technologies. Data analytics, artificial intelligence, and robotics are at the forefront. These advancements hold immense promise for improving patient care. For decades, healthcare has relied on traditional methods. Doctors diagnosed illnesses based on symptoms and medical history. Treatments were often standardized. However, the digital age is changing this paradigm. Now, we can collect and analyze vast amounts of data. This data can be used to personalize treatments and predict health outcomes. The potential benefits of this transformation are enormous. Imagine a world where diseases are diagnosed earlier and more accurately. Imagine treatments tailored to your unique genetic makeup. This is the future that healthcare data analytics is striving to create. At the heart of this digital revolution lies artificial intelligence, or AI. AI, particularly machine learning, has the potential to revolutionize healthcare. Machine learning algorithms can analyze massive data sets. They can identify patterns and make predictions that would be impossible for humans to discern. One of the most promising applications of AI is in medical imaging. AI algorithms can now analyze X-rays, kinetic scans, and MRIs with remarkable accuracy. They can detect subtle anomalies that might be missed by the human eye. This early detection can be life-saving, particularly in cases of cancer and other serious diseases. But AI's potential extends far beyond image analysis. It can be used to develop new drugs and therapies. It can personalize treatment plans based on a patient's genetic profile and lifestyle factors. AI-powered virtual assistants can even provide patients with 24/7 medical advice and support. Another exciting area of advancement is robotics. Surgical robots are already being used in hospitals around the world. These robots allow surgeons to perform complex procedures with greater precision and control. They also minimize invasiveness, leading to faster recovery times for patients. Robotics is also transforming rehabilitation. Robotic exoskeletons are helping paralyzed patients walk again. Robotic arms are assisting stroke victims in regaining motor skills. These devices provide hope and improve the quality of life for countless individuals. The integration of robotics into healthcare is still in its early stages. However, the potential benefits are vast. As technology continues to advance, we can expect to see even more innovative applications of robotics in the years to come. The driving force behind these advancements is data. The healthcare industry is awash in data. Every patient encounter, every test result, every prescription generates valuable information. The challenge lies in harnessing this data and transforming it into actionable insights. This is where big data analytics comes in. By analyzing vast data sets, we can identify trends and patterns that would otherwise remain hidden. We can learn which treatments are most effective for specific patient populations. We can predict disease outbreaks and develop targeted interventions. Data analytics can also help us to improve the efficiency and affordability of healthcare. By identifying areas of waste and inefficiency, we can streamline processes and reduce costs. We can also use data to develop preventive measures that keep people healthy and out of the hospital. The healthcare landscape is undergoing a seismic shift, transitioning from a reactive model to a proactive and predictive one. This transformation is fueled by an unprecedented surge in data, a phenomenon we've come to know as big data. This isn't just about the sheer volume of information being generated, it's about the variety and velocity at which it's accumulating. Imagine a vast digital ocean constantly expanding with data points from electronic health records, medical imaging, genomic sequencing, wearable health trackers, and even social media activity related to health. Each data point, seemingly insignificant on its own, becomes a piece of a much larger puzzle. When pieced together through sophisticated analytics, these fragments reveal hidden patterns and insights that can transform healthcare as we know it. Big data in healthcare encompasses everything from patient demographics and medical histories to treatment outcomes, insurance claims, and pharmaceutical research data. It's the lifeblood of modern healthcare analytics, providing the raw material for algorithms and machine learning models to learn and make predictions about individual patients and populations at large. The sheer volume and complexity of big data in healthcare necessitate robust systems for storage, organization, and retrieval. This is where data warehouses come into play. Think of a data warehouse as a massive, meticulously organized library, specifically designed to house and manage healthcare data. Unlike traditional databases that are often siloed within specific departments or institutions, data warehouses break down these barriers. They integrate data from disparate sources, creating a unified view of patient information. This integration is crucial for obtaining a holistic understanding of patient health, enabling healthcare providers to make more informed decisions. Data warehouses employ sophisticated data modeling techniques to ensure consistency and accuracy, transforming raw data into a structured format that can be easily queried and analyzed. They also implement robust security measures to safeguard patient privacy and comply with stringent healthcare regulations such as HIPAA. With data securely stored and organized within a data warehouse, the real work of extracting meaningful insights can begin. One of the most powerful tools in a data scientist's arsenal is regression analysis. This statistical method helps us understand the relationships between different variables within a dataset. In a healthcare context, regression analysis can be used to determine the factors that influence a particular health outcome. For instance, it can help us understand how age, gender, lifestyle choices, and pre-existing conditions might affect a person's risk of developing heart disease. By identifying these relationships, healthcare providers can develop targeted interventions and personalized treatment plans. Regression analysis also plays a crucial role in clinical trials, helping researchers determine the efficacy of new drugs and therapies. Section 4. Trend analysis. Predicting the future of healthcare. The ability to predict future trends is invaluable in healthcare, allowing for proactive interventions and more effective resource allocation. Trend analysis, a cornerstone of healthcare data analytics, involves examining historical data to identify patterns and extrapolate them into the future. By analyzing trends in disease prevalence, hospitalization rates, treatment costs, and other key metrics, healthcare systems can anticipate future needs and allocate resources accordingly. For instance, trend analysis can help hospitals prepare for seasonal surges in flu cases or predict the demand for specific medical specialties. Trend analysis is also instrumental in public health initiatives. By tracking the spread of infectious diseases, identifying at-risk populations, and monitoring the effectiveness of vaccination programs, public health officials can implement timely interventions to mitigate outbreaks and improve population health. Section 5. The predictive power of data, from individual patients to global health. The true potential of healthcare data analytics lies in its ability to make predictions that can guide clinical decisions, improve patient outcomes, and shape the future of healthcare delivery. This predictive power is evident at both the individual patient level and on a global scale. Imagine a future where your doctor, armed with insights from your electronic health records, genomic data, and even your wearable fitness tracker, can predict your risk of developing certain diseases years in advance. This early warning system allows for preventative measures and personalized interventions, potentially delaying or even preventing the onset of chronic conditions. On a global scale, healthcare data analytics can help us track the spread of pandemics, identify emerging health threats, and develop strategies to contain outbreaks. By analyzing data from around the world, we can gain a deeper understanding of disease patterns, identify risk factors, and develop more effective treatments. Section 1. The Shadows of Bias. How data can perpetuate inequality. Data, often seen as objective, can perpetuate bias. It is generated within a biased social context. These biases influence algorithms, leading to skewed outcomes. The result is a healthcare system that can perpetuate disparities. Algorithms, the engines driving much of healthcare data analytics, are often touted for their objectivity. However, these algorithms are only as good as the data they are trained on. When data reflects existing societal biases, the algorithms trained on this data inherit and amplify these prejudices, leading to what is known as algorithmic bias. Imagine an algorithm used to allocate limited healthcare resources, such as organ transplants or specialized treatments. If the historical data used to train this algorithm reflects racial bias in healthcare access and treatment decisions, the algorithm might unfairly disadvantage certain racial groups. This bias can manifest in subtle ways, making it difficult to detect without careful scrutiny. For instance, an algorithm might prioritize patients with higher healthcare expenditures, assuming they are sicker and require more resources. However, this assumption fails to account for the fact that racial minorities often receive less healthcare and have lower healthcare expenditures, even when facing similar health conditions. Consequently, the algorithm, while seemingly neutral on the surface, could perpetuate existing disparities in healthcare access. The racism embedded within healthcare data is not a new phenomenon. It's a reflection of historical and systemic inequities that have long plagued the healthcare system. From the Tuskegee syphilis study, where Black men were denied treatment for syphilis to observe the disease's progression, to the ongoing disparities in maternal mortality rates between Black and white women, the history of healthcare is marred by racism and discrimination. These injustices leave an indelible mark on the data we collect. For instance, studies have shown that Black patients are less likely to receive pain medication than white patients, even when presenting with similar symptoms. This disparity, rooted in racist stereotypes and implicit biases, becomes embedded in the data, potentially influencing algorithms used to assess pain levels and prescribe pain management strategies. The danger lies in assuming that historical data is an accurate reflection of objective reality. Failing to acknowledge and address the racism embedded within healthcare data perpetuates a cycle of inequality, where algorithms and predictive models trained on this biased data reinforce existing disparities. One of the most significant shortcomings of many healthcare data analytics initiatives is the failure to adequately account for the social determinants of health. These factors, including socioeconomic status, education level, access to healthy food and housing, and exposure to environmental hazards, play a crucial role in shaping health outcomes. Focusing solely on clinical data, such as medical history and lab results, while ignoring the social context in which health and illness occur, provides an incomplete and often misleading picture of an individual's health risks and needs. It's like trying to solve a puzzle with only half the pieces. For instance, a predictive model designed to identify patients at risk of hospitalization might flag individuals living in impoverished neighborhoods with limited access to healthcare as high risk. However, this prediction might be driven more by their zip code and the systemic barriers they face in accessing timely care than their underlying health status. Section 5. The illusion of objectivity. Data as a reflection of societal biases. Data is often perceived as objective, a neutral reflection of reality. However, this perception is an illusion. Data is not inherently objective. It is a product of human choices and societal structures. The data we collect, the way we collect it, and the questions we ask of it are all shaped by our biases and assumptions. For instance, if a healthcare system consistently underinvests in healthcare services for certain racial or ethnic groups, the data collected will reflect this inequity. The data might show that these groups have poorer health outcomes, but it won't necessarily reveal the systemic factors driving these disparities. To mitigate bias and promote equity in healthcare data analytics, we must acknowledge that data is not a neutral arbiter of truth. It is a mirror reflecting our societal biases and inequities. By recognizing this, we can begin to develop more responsible and equitable data practices. Section 6. The urgency of ethical data practices towards a more equitable future. The potential of healthcare data analytics to improve patient care and revolutionize healthcare delivery is undeniable. However, this potential can only be fully realized if we address the ethical challenges posed by data bias and strive to create a more equitable and just healthcare system. This requires a fundamental shift in how we approach healthcare data. We must move beyond the illusion of objectivity and acknowledge that data is not inherently neutral. We must critically examine the data we collect, the algorithms we develop, and the decisions we make based on data analysis. This involves investing in diverse teams of data scientists, ethicists, and healthcare professionals who can identify and mitigate bias at every stage of the data lifecycle. It also requires engaging with communities that have been historically marginalized and incorporating their perspectives into data collection and analysis. Section 1. The diversity deficit, a call for representation in data. The promise of healthcare data analytics hinges on reflecting population diversity. However, this is often not the case. A significant diversity deficit plagues healthcare data, with racial and ethnic minorities often underrepresented. This lack of representation has serious consequences. Algorithms trained on non-diverse data are prone to errors and biases. Imagine a facial recognition algorithm struggling with darker skin tones, leading to delays in care. The diversity deficit in healthcare data reflects deeper societal inequities. Marginalized communities often have limited healthcare access, leading to fewer data points. Mistrust of the healthcare system can make individuals hesitant to share their health data. Addressing the diversity deficit in healthcare data requires more than simply collecting more data from underrepresented groups. It demands a fundamental shift in the field of data science itself. The lack of diversity among data scientists, the individuals responsible for developing and deploying algorithms, contributes to a blind spot in how we approach data analysis and interpret its results. When data scientists come from homogeneous backgrounds, their lived experiences and perspectives inevitably shape the algorithms they create. They might unknowingly introduce biases based on their own assumptions about race, ethnicity, gender, or socioeconomic status, even when striving for objectivity. Diversifying the data science workforce is crucial for developing algorithms that are sensitive to the nuances of human diversity. Data scientists from underrepresented communities bring unique insights and lived experiences to the table, challenging assumptions and identifying potential biases that might otherwise go unnoticed. Their perspectives are invaluable in ensuring that algorithms are designed and deployed in a way that promotes equity and fairness in healthcare. Addressing the diversity deficit in healthcare data requires a shift from a top-down approach to data collection, where researchers and institutions dictate the terms, to a more collaborative and community-engaged model. This involves actively engaging with marginalized communities, building trust, and empowering them to have a voice in how their data is collected, used, and shared. Community engagement starts with listening. Researchers and data scientists must take the time to understand the historical context, cultural sensitivities, and concerns of the communities they aim to serve. This involves building relationships with community leaders, establishing trust, and addressing any misconceptions or fears about data privacy and ownership. Beyond simply obtaining consent, community engagement should empower individuals to shape the research agenda. What health questions are most important to the community? What data should be collected, and how should it be used to address health disparities? By involving communities in the research process from the outset, we can ensure that data collection efforts are aligned with their needs and priorities. Even with diverse data, bias in algorithms remains a concern. Biases can creep in at various stages, from data collection to algorithm design. Rigorous auditing for fairness and equity is essential. Algorithmic auditing identifies and mitigates biases based on protected characteristics. Section 5. Beyond representation, addressing systemic barriers to health equity. Increasing diversity in data science is crucial, but alone, it can't address health disparities. Systemic racism, poverty, and lack of access to quality healthcare are deep-rooted issues. Data analytics can't solve these problems alone. We must act on insights to dismantle these structures. Addressing social determinants of health requires a multi-pronged approach. Investing in underserved communities is essential. Expanding access to quality healthcare, housing, food, and education. Implementing training programs to address implicit bias in healthcare. Advocating for policies that promote health equity. Supporting policies that address income inequality and combat discrimination. Data analytics can monitor interventions and hold institutions accountable. Data is a tool that must be used ethically to create a just healthcare system. Section 1. The Paradox of Spending and Outcomes. A broken system exposed. The U.S. stands as an outlier, spending more on healthcare but achieving poorer outcomes. Despite high spending, the U.S. lags in key health indicators, highlighting a system in need of reform. Year after year, the numbers tell a disconcerting story. The U.S. spends nearly twice as much per capita, yet life expectancy is lower, and chronic disease rates are higher. This disconnect exposes a fundamental flaw in the U.S. healthcare system. This paradox frustrates patients and healthcare providers alike. Doctors struggle between providing care and navigating a complex system driven by financial incentives. Patients face soaring costs, limited access, and a system more concerned with billing than well-being. Section 2. Administrative burden. The weight that stifles innovation. One of the most glaring inefficiencies in the U.S. healthcare system is the crushing administrative burden that weighs down providers and diverts resources away from patient care. Unlike many other developed nations with universal healthcare systems, the U.S. relies on a patchwork of private and public insurers, each with its own set of rules, regulations, and billing practices. This fragmented system creates a logistical nightmare for healthcare providers who must navigate a labyrinthine bureaucracy to get paid for their services. Doctors and nurses are forced to spend countless hours on paperwork, battling with insurance companies over pre-authorization requirements, coding complexities, and denied claims, time that could be better spent with patients. This administrative burden not only contributes to physician burnout and dissatisfaction, but also stifles innovation and drives up costs. Healthcare providers are often hesitant to adopt new technologies or treatment approaches due to the fear of bureaucratic hurdles and potential payment denials. This inertia perpetuates a cycle of inefficiency where outdated practices persist and the system as a whole struggles to keep pace with advancements in medical science. At the heart of the U.S. healthcare crisis lies a fundamental misalignment of priorities. Unlike many other developed nations that view healthcare as a fundamental human right, the U.S. system operates largely within a for-profit framework, where insurance companies, pharmaceutical companies, and healthcare providers often prioritize financial gain over patient well-being. This profit-driven approach manifests in various ways, from the exorbitant prices of prescription drugs to the overuse of expensive medical procedures, often driven by financial incentives rather than clinical necessity. Insurance companies, beholden to shareholders, engage in practices like denying coverage for pre-existing conditions or limiting access to essential care to maximize profits. This focus on profits over people has far-reaching consequences. Patients are often forced to make impossible choices between their health and their financial security, delaying or foregoing necessary care due to the fear of crippling medical debt. This, in turn, leads to poorer health outcomes, increased healthcare costs in the long run, and a widening health equity gap between the haves and the have-nots. The U.S. leads in medical innovation, from cancer treatments to minimally invasive surgery. However, this comes at a high cost, often borne by patients. Developing new drugs and devices is expensive, requiring years of research. These costs are often inflated due to a lack of transparency. This creates a barrier to affordable care, especially for chronic conditions. Breaking free from the cycle of high spending and poor outcomes requires a fundamental shift in the U.S. healthcare system's priorities, a shift from a reactive, treatment-focused approach to a proactive model that emphasizes prevention, early detection, and addressing the social determinants of health. Investing in public health initiatives like vaccination programs, disease screenings, and health education campaigns can help prevent illness and reduce the need for costly medical interventions in the long run. Addressing the social determinants of health, such as poverty, lack of access to healthy food, and environmental hazards, is crucial for creating a healthier population and reducing health disparities. This shift requires a commitment to addressing the systemic inequities that drive health disparities, ensuring that everyone has access to quality health care, regardless of income, race, ethnicity, or zip code. It also requires a reevaluation of the for-profit model that dominates the U.S. healthcare system, exploring alternative approaches that prioritize patient well-being over financial gain. The journey through healthcare data analytics reveals progress and disparity. Benefits include earlier diagnoses and personalized treatments, yet bias and inequity persist. We must balance innovation with equity, foster innovation while ensuring equitable access. Healthcare benefits must be accessible to all. Section 2. The human factor, augmenting, not replacing human judgment. As we venture deeper into the age of artificial intelligence and algorithmic decision-making, it's crucial to remember that technology is a tool, not a panacea. The human factor remains paramount in healthcare, and the role of data analytics should be to augment, not replace, the expertise, empathy, and ethical judgment of healthcare professionals. Algorithms, for all their computational prowess, lack the nuanced understanding of human experience, the capacity for compassion, and the ability to navigate the complexities of ethical dilemmas that are inherent in healthcare. A doctor's decision-making process goes beyond analyzing data points. It involves listening to the patient's story, understanding their values and priorities, and considering the social and emotional context of their health. The integration of data analytics into healthcare should empower, not sideline, healthcare providers. By providing them with timely insights, identifying potential biases, and flagging areas for further investigation, data analytics can free up clinicians to focus on what they do best: building relationships with their patients, providing compassionate care, and making informed decisions that prioritize the patient's best interests. Section 3. The Quest for Ethical AI. Building Trust in the Age of Algorithms. The use of artificial intelligence in healthcare raises profound ethical questions. Ensuring fairness, transparency, and accountability in AI is paramount. We cannot allow biases to perpetuate health disparities. Building trust in AI requires a multifaceted approach. Transparency and explainability are crucial. Patients deserve to understand AI conclusions. Bias detection and mitigation are crucial. Techniques to mitigate bias must be developed. Human oversight and accountability are essential. Clear lines of responsibility must be established. Ethical AI in healthcare requires collaboration. Embedding ethics in AI ensures fairness and justice. Section 4. A Call to Action. Shaping the future of healthcare together. The future of healthcare is shaped by our choices, investments, and commitment to a just world. Health disparities, rising costs, and ethical complexities demand a collective response. This is a call to action for all stakeholders. Policymakers, promote health equity and regulate AI in healthcare. Healthcare institutions, diversify workforce, implement bias training, and adopt ethical guidelines. Data scientists, develop fair algorithms and collaborate with communities. Patients, advocate for your rights and a system prioritizing well-being. Together, we can create a future where technology serves humanity and health for all. Section 5. A Future of Hope. Towards a more equitable and healthier world. The convergence of data analytics, artificial intelligence, and healthcare holds immense promise for the future of medicine. We have the tools to unlock new frontiers in disease prevention, diagnosis, and treatment. Yet, this future is not guaranteed. Realizing the full potential of healthcare data analytics requires a shift in perspective. It demands a commitment to dismantling systemic inequities. We are presented with a choice. We can choose to exacerbate disparities or forge a path of equity. Let us work together to build a future worthy of our shared humanity.